Radiation sources. For patients, radiation dose come from the X-ray tube. For the medical personnel, radiation dose comes from the patient. Lowering the dose to the patient means lowering the dose to the staff. How to achieve radiation protection? The three basic principles of protecting yourself and others from radiation are time. Less time spent reduces radiation exposure. Distance, greater distance from the source, less radiation received. Shielding, behind, shielding from source, less radiation received. Time, total exposure time should be LRA, as low as reasonably achieved. Less exposure, less dose. Fluoro time is often used as an indication of the patient dose, but the correlation is very poor. Fluoro time should not be used as the only dose indicator. Optimizing time in an interventional procedure considers numbers of images, number of X-ray pulses per image, number of retakes, number of cine runs and their duration. Cine dose is much higher than fluoro dose and frame rate. Determine the minimum number of frames per second needed. Fluoro rate 3.75 to 7.5 frames per second. Use balloon and wire markers. Do not use radiation. No pedal. Use balloon and wire markers. Use trapping technique for equipment exchange. Distance. Know when the beam is on. Check where the tube is. Check where the X-ray enters the patient and will be scattered. The patient is the source of radiation. Keep distance. Put the tube under the table. Operator should avoid a place next to the tube. Step back from the patient, preferably behind shielding. Do not slouch over the patient, but stand upright. Keep your hands out of the radiation field. Put the detector as close as possible to the patient. If not needed in the room, leave the room. Try not to be standing next to the patient. Use power injection for contrast material injection when feasible. Ergonomics in the room. Place the monitors away from the X-ray source. Analysis of danger is essential. Would you put your hand under X-rays? The distance is important. Shielding. Lead shielding is critical for protection of medical personnel. Lead aprons, thyroid shield, eye wear, gloves, cap, gonadal shield, ceiling mounted lead shield, tube side shields. Protective garments stop approximately 95% of scatter radiation. Not even the best lead is going to free you from needing to be careful with the radiation. It is responsibility of the owner of the facility or the MD to create a radiation awareness culture. Shielding. Wearing this heavy lead apron has proven to lead to an increase in orthopedic back pain issues among interventionalists. The interventionalist disc disease. A possible solution to this problem is zero gravity radiation protection system. It uses a ceiling supported gantry system to support a walk-in lead-lined suit that eliminates the weight of the lead apron being placed on the body of interventionalist. The gantry allows for smooth movement along the X, Y, and Z axis. For operator safety, robotic PCI is being promoted. For operator safety, reduce the scattered radiation through robotic PCI. Radiation protection of staff in cath labs. Use protective device, advisable skirt type lead apron to distribute the weight, a 0.25 mm lead equipment but with overlap on front to make it 0.5 mm on the front and 0.25 mm on the back provides more than 80% to 90% protection. Lead glasses I wear with side protection and thyroid protection is necessary. Make good use of the time distance shielding principle. Minimize time, maximize distance as much as clinically possible. Use shielding.